Welcome to Ask Sid, the official podcast for Sydenham Clinic, a clinic where luxury meets medicine. We are on a quest for longevity. And I am so thrilled to be your host on this show. My name is Anchal Bhatia. I am the founder and CEO of Sydenham Clinic and the author of Your Doctor is Not God and How to Be the CEO of Your Health. I look forward to taking this journey with all of you and having amazing thought leaders, guests, and members of our Sydenham team answering questions that you put forward. And I urge you, and I hope you will, ask Sid more questions on longevity, wellness, living to your highest potential. We are all trying to be the best versions of ourselves. And our physical, emotional, and mental health is foundational for us to achieve health and success in other realms of our life. So welcome to Ask Sid. Welcome back to another episode of Ask Sid. And as you can see, I'm joined by our medical director here at Sydenham Clinic in Houston, Dr. Terry Rice. Welcome, Dr. Rice.
Thank you. Thank you so much. It's great to be here again.
Yes, and I can see that our members and our listeners are really taking on to Ask Sid. It's getting popularity. We're getting a lot more questions.
Great.
And so today's topic is actually addressing a very important topic for high-performing individuals. Mm-hmm. And if you're an entrepreneur or a high-performing individual that leads a very high-stress life, or you're an executive, this episode is for you. We're going to be talking about executive health testing in the era of precision medicine and artificial intelligence. With so many tests out there, I think it can get confusing. And busy executives are often on the run, they're busy, they're traveling. It's not a 9-to-5 job. There was research done that executives actually spend over 62 hours a week working. So in that high stress environment, they are likely to be overweight. In fact, 82% of CEOs are overweight. 58% of them are likely to get a heart attack. And 69% of CEOs are unfit. There's a 30% chance that CEOs are going to get cancer. And 100% of CEOs present some sort of a psychosomatic ailment related to stress. Post-COVID, I think stress levels have become higher. There was a study done by Oracle and Workforce that 78% people reported more stress. So executive health testing is more important today than it ever was. However, it has changed so dramatically. Executive health testing is not what it was a year or 2 years ago. And there is so much revolution that's happened in this space. And I'm here with Dr. Rice. We're going to unpack all the cool AI-driven, all the cool precision medicine diagnostics that are out there and what a really good executive health checkup should look like. So thank you, Dr. Rice. I'm ready to dive in to this topic because you've changed a lot of lifestyles and you deal with a lot of high-powered, high-performing individuals. So what is it like? Like when they come to you, mm-hmm. What is it that they're looking for?
Right. Well, first of all, the statistics that you just rattled off are pretty mind-blowing, right? I mean, We know there's a health crisis in the United States, particularly with metabolic syndrome and also, of course, with obesity and probably with the food choices that are easily available to us. And when you think about people who travel, because most executives have to travel so much nowadays, and then you think about how we're constantly changing time zones and interrupting our sleep, and then of course, eating out, eating in restaurants, or even worse, you show up in a hotel late at night and the only thing available to you, you're starving, you get off the plane, you get there 11:30 p.m., and what's available? Donuts,
cheeseburgers,
candy bars,
pizza.
You're lucky if even that, even that much. So I think it's really difficult to maintain your health when you're moving and traveling like that all the time. I would say that at Sydenham Clinic, so many of our patients are so interested in their health that we do kind of self-select out a group of patients that tend to be healthier than the average executive. But one of the things that is important is, of course, to, one, get people's attention, make them understand that this is important, that it is time to put down the cell phone and actually focus on their health a little bit, and then make it easy. You know, if it's a big chore and it's difficult for scheduling and different procedures that have to be done in different places, then that is, of course, another hurdle, and it can be very difficult for these people to scale that hurdle. So I think making it easy is important also.
So you were part of the traditional healthcare system for almost, majority of your career, and you see the traditional executive health checkups, right? And you've curated this cutting edge executive health program that we have here at Sydenham. How is it different? Like, why should we be embracing this cool technology? Is it just an eyewash? Can you highlight like the difference between traditional and precision medicine based executive health checkups?
Right. Well, it's just night and day. I mean, we have so much information now and so many tools at our disposal. It used to be that an executive physical was essentially a treadmill test, a physical exam, hearing and vision screening, blood pressure, heart rate, oxygen, maybe pulmonary function test, and some labs. And then, of course, a stress test. Did I mention that? A stress test is usually a treadmill test. Well, the amount of stuff that is missed on that is really, incredible. And now we have so many, fabulous tools at our disposal. First of all, our laboratory testing that it's available to us now is just, light years away from where it was before. Not just the tests that we can get at places like LabCorp that you think of as the non-sexy tests. We have so many more tests that we can get through just from a simple blood draw, that give us a lot more information. Like, we didn't used to check for inflammatory markers. We didn't used to check for fasting insulin levels. These are things that help us know so much about, metabolic syndrome, to warn people that they're predisposed to diabetes or prediabetes. But beyond that, now we have things like the Gallery test, commonly talked about as the Grail test. And so this is using new science, looking for methylation patterns, essentially looking for the traces of cancer DNA in just a blood test.
One drop of blood.
Well, it's a tube, but how much?
So one tube or one vial of blood.
One vial of blood, and often referred to as a liquid biopsy as well. Now, it's not 100%. It doesn't screen for every malignancy, but it is a great test, and it's certainly valuable information. And with one vial of blood that can tell you, particularly the cancers that are hard to find and almost always diagnosed too late, like pancreatic cancer, gallbladder cancer, some of these cancers that are really difficult to find until it's too late. It's an excellent tool, and why not, right? Why
so
not
liquid biopsies
arsenal?
are the latest rage right now.
Yes.
And traditional medical systems or traditional doctors' offices, some of them are not even aware of it and have not incorporated them in the executive health checkup.
That's true.
Almost all your patients have been tested on liquid biopsies. Like, what has your personal experience been? Like, you've done so many of it.
I think it's a fabulous test. Our personal experience we have not had any false positives. The one positive that we've had was indeed, the patient did have the malignancy. That result came back faster than her actual biopsy, so the diagnosis was made more quickly. I found the company to be super aggressive about reaching out to me. It's not like you worry about that lab test sitting somewhere and you haven't picked it up or found it in your inbox yet. They called me, texted me, emailed me. So I think it's a great test, and I really like it in my patients that have had previous malignancies. So my patients who had previous history of breast cancer, it's very sensitive in recurrent disease, okay? Because then it's metastatic and it's outside of the initial little encapsulation. Recurrent head and neck cancer, it's excellent for that because that's another malignancy that's so common, and there's so many survivors out there that are just working day to day and have returned to their normal lives. So it helps me feel more secure that this person is safe rather than having to worry about how often did I scan them. So you can kind of stage it with maybe follow-up scans, but also with the Grail test. So it's a great test.
Easier, right? And especially if you're a busy executive, and if you're saying there's a 30% chance that executives do get cancer,
right?
And then they need to be followed up post-cancer. I think this is a good way for them to stay on top of their health.
Yes.
And is it done annually?
Yes, we do it annually in our patients 50 and over.
Okay, so the liquid biopsy is a cutting-edge executive health tool that can be done quickly for executives. It's easy to screen out a lot of different types of cancers, and very often by the time you have a symptom, it's a little too late.
Yes, in many of these malignancies, it's too late. Yes, early diagnosis is definitely the key. Another product that we're starting to use now is called GeneType, and that's a fascinating test. It doesn't look for malignancy itself, but it gives you an idea based again on methylation patterns, genetics, other risk factors, what diseases you may individually be at risk for. So it gives you an idea about whether you're at high risk for breast cancer, colon cancer, ovarian cancer, atherosclerosis, heart disease. So that helps. I mean, I think, why would you not want to know those things? Because then that would be more incentive to change your lifestyle, but also early screening then would be, indicated. So this individualization, like looking at people as an individual, is so important, and that should be part of an executive health screen, not just one size fits all.
No, not at all. And you talked about this test and methylation for the lay people out there. Can you explain why methylation is important?
Yeah.
This
is really getting into the weeds, but methylation is important because methylation is how your body turns genes on and off. Okay?
Wow.
So if you think about it, every gene that we have is in every cell in our body, but all of these cells are doing different things, right? So our body has to know which genes to utilize in the liver as opposed to in the skin, just as an example.
Right.
Okay? Because all the genes are there. Okay? And methylation is simply, it's the addition of a one carbon molecule with 3 hydrogens, and that's like a signaling mechanism, and it's put on the gene, and it tells the body in some cases to turn it on, in some cases to turn it off. But it's part of epigenetics,
right?
And it's really the new frontier, and we're discovering how important that is.
That is so fascinating.
Yeah.
This is fascinating where healthcare is going. A lot of people are now following a fad of full body MRIs.
Yes, yes.
Now that seems to be the whole new thing. Now at Sydenham, you have a certain standard, and you're very, mindful about who really qualifies for a full body MRI, and you certainly don't want everybody rushing and getting full body MRIs every year. So can you please help people understand what is this fad all about, and how do you incorporate it in your practice, and why is it a good tool for executive health testing?
Right. So full body MRI, like you said, has really become an area of interest, and it's just recently become available. And so you might say, well, why? I mean, if we could do an MRI of our body, why weren't we doing that 10 years ago? Well, the problem is that it takes a long time. So you can spend an hour and a half in an MRI scanner just looking at your spine, okay? So what the advance has been the ability to change this hardware, both the MRI machine, but more importantly, the software, how that MRI machine is programmed so that you can do a full body MRI in a time span that's tolerable. Because if you've ever been in an MRI machine, most people don't like it.
Yeah.
It's a small space. There's often a problem with claustrophobia. there's a lot of noise, and you can't move, so you have to lie there for a prolonged period of time without movement. And that's been interesting for me, because as full body MRI has come available to our patients, a lot of them don't want it.
That's surprising.
Yeah, because they don't want to be in that scanner. They don't want to have to hold still. They don't like the noise. They have feelings of claustrophobia. The larger you are, not necessarily overweight, but the larger your body habitus, the smaller that machine, feels, and how more cramped that you feel. But I think a lot of this was spearheaded by Prenovo, who was a company who really uses a smaller magnet, but really wrote the software so that there were fewer false positives, but also it was a sensitive test and could get it done on individuals in a timely manner. So they have been on the news a lot and picked up by a lot of the podcasts, et cetera. So that is a possibility. In my experience, I have had several patients who've done their scans with Prenovo. We have been using a more classic type of full body MRI.
More detailed,
We're
more
getting
thorough.
more details.
Yeah.
It is done in 40 minutes, and that includes neuroquant. So you're talking about imaging of the brain and the full body in just about 40 minutes. I would say that there is more details. There's certainly more information. The downside of that is we're getting a little bit more what we could call noise. We're not sure if this is relevant clinically or not. Do we need to do another test to follow up on it? But those are the two options that are available to our patients now. And I think it's a good thing. I think it's really a good thing.
So what is it that you really see? Is a full body MRI actually a full body MRI? Because I think that's also misleading, because it's not the legs and the arms, right? So can you really explain what is it that you see in a full body MRI and what is a full body MRI?
Right. So in most places, a full body MRI, of course, includes the brain. And that's very important, because it's also equivalent to doing a study of the arteries that go to the brain. So it is equivalent to doing like a carotid ultrasound. You can make sure that the main arteries that go to the brain are not occluded by plaque, atherosclerosis. And then also it looks for what's called the circle of Willis. So many people aren't aware, but you have 4 arteries, your carotids and your vertebrals, that go up your neck to your brain, and then they're like in a circle at the bottom, and then the branches come off to feed the brain. And so this is where a lot of strokes occur, particularly aneurysms. So aneurysms tend to run in families. They're hereditary. They're present in about 1% of the population. My mother actually died of a ruptured aneurysm. And then they also look for strokes, changes in your brain with aging, it's like oxidative stress. They're called white matter lesions, where your brain health is starting to show some aging. And then, of course, looking at your neuroquant, like how large is your hippocampus? Is your brain shrinking? Things that people want to know about their ability to maintain their
detect
brain.
Alzheimer's and dementia particularly, or you get a trend?
So, no, you get a trend. Alzheimer's and dementia, those are more clinical diagnoses. But it can alert you to some changes that may be premature aging that could be indicative or concerning for those things. So that is the top part, of course. So you get the head and the neck, and then MRI through the chest, and then also the cervical spine, the thoracic spine, the lumbar spine, so your entire spine. And then the heart is not really looked at. It's not the best test for that. The lungs, like I said, are viewed. Not the best test for the lungs, but then you're getting a good look at the liver. You can tell your patient if they have fatty liver disease, the pancreas, what everyone's kind of worried about. Pancreatic cancer is so common, usually not diagnosed until it's at a stage where it's terminal. The GI tract, You still need colonoscopy to be really sure and to prevent cancer. You don't want to find it once it's a cancer, which is when it would usually show up on an MRI. You get a good look at the ovaries, the uterus. And then, of course, people have unusual malignancies, such as malignancies like a sarcoma that start in the muscles, that these things are found very late. So it would show something like that as well. I had mine, and when I got on the machine, I was like, how does my shoulder look? I mean, how does my shoulder look? That's been killing me. And they're like, oh, we didn't get your shoulder. So it's often not really, knees and stuff like that are not really looked at as closely.
What about the breasts? Because some women have dense breasts and they need to get MRIs. Like,
yes.
It's
not a substitute for that.
No.
It might find a lesion, a mass that's large, but it's not a substitute for dedicated mammography, etc.
So it's a myth. Oh, I got my full body MRI. I'm all good. It sounds more like a myth. I think there's a lot more that goes into testing than just a full body MRI and getting peace of mind.
Right, but it is a piece of the puzzle. It does make you feel good.
Yes.
You know, but it's not everything. Yeah, you still need to get your routine screening.
So then the next AI-enabled tool, which I think officially we've been told you've done the maximum numbers of AI-enabled cardiac testing, which is the Clearly test in Houston.
Yeah, probably.
Now, yes, really.
By far, yeah.
Nobody, we have the Texas Medical Center, the Texas Heart Institute, and Sydenham Clinic has done more Clearlys than the medical center doctors. So it's fascinating. Can you explain what this Clearly test is, and how have you incorporated it in the practice?
Yeah, so this I think is just an amazing breakthrough, and I think we may have mentioned this in another podcast previously, but Clearly is looking at the heart. So it's a CT scan, but you inject dye in the vein, so peripheral dye, and you get a picture of all the blood vessels that feed the heart muscle, okay? And not only do you get a picture of those vessels, they give you a report where they just straighten out those arteries so they look like tubes, and you can see every speck of plaque, calcium, the quality of the plaque, how much the artery is narrowed, and it's way superior to a stress test, and it's just an incredible piece of information. It's done in you're in this machine like 5 minutes. Of course, there's a little bit more prep time to that, getting the IV started and stuff. But that has been, I think we've already saved a couple of lives with that already, or at least prevented people from having heart attacks. So that's just been
traditionally people looked at cholesterol and they looked at maybe the calcium score, right? Those were the two main things that people would look at in an executive health checkup.
Yes.
But how is Clearly different from that? Do you still need to watch the other markers?
Yeah. So cholesterol, I don't know that cholesterol really causes heart disease. It's certainly utilized by the body to be placed in a damaged artery and cause narrowing of the arteries. I'm not opposed to lowering people's cholesterol by any means, but it's not the whole picture. I think that inflammation is really showing now to play a more important role. The CT calcium score we still use as a screening test. There are individuals who say that if your CT calcium score is 0, you can still have a heart attack, but I'm not seeing much of that. But the calcium score just shows us if you have any calcium deposited in the plaque in your arteries. So that can take somewhere between 10 and 30 years of the atherosclerotic process starting. And it only shows you the calcium, and it doesn't show you how much the arteries are narrowed. Whereas Clearly allows us to show what kind of plaque it is. Is it very soft? Is it cholesterol, which is then potentially reversible? Is it calcified, meaning it's mature and it's probably going to stay there? And how much narrowing there is. And now for the first time, we can do a Clearly on a patient. We can repeat it in a year or two, and we can tell them whether this atherosclerotic process is reversing, or if it's progressing, or if it's a medical emergency or something that needs an intervention.
Fabulous.
And then I think, now Clearly is coming out with a ischemia tool. So that means not only are these changes in the arteries, it's going to tell us not only are they anatomically narrowing the artery, but are they actually reducing the blood flow through the artery? And they've done a lot of testing on this, compared it to PET CT, which is thought to be the gold standard, PET scan, to be the gold standard about whether there is a true compromise in the blood flow, and it is equivalent or better, and is evidently being approved by Medicare and insurance now. So that's something that we're going to be getting into in the very, very near future, and it's going to be another fabulous tool.
Well, thank you so much for being ahead of the game here at Sydenham and always embracing cutting edge technology. And for all the executives out there, I think this is a really good time for you to step up. And I see like that change. People are becoming more health conscious, they're biohacking. And now that these tools are available, it is the right time to really focus on your health and embrace this technology and not bury ourselves under the sand. Some people don't want to know, but I think the earlier you know, the better it is.
Right. We have so many great tools now, and it still can be easy to do this.
Yes.
And the information is really incredible.
Well, thank you. So I hope you enjoyed today's episode, because we take care of a lot of executives here and we understand it's hard being a leader and it's very lonely on top. And it's not easy to take care of your teams, your businesses, and yourself. But that's where concierge medicine comes in. That's where having a good relationship with your primary care doctor and a team comes in. Like, let them help you take care of yourself. So thank you so much for this episode.
Thank you, Anshul.
And please keep sending us more questions. We have our fabulous team at Sydenham Clinic. We are happy to take more questions at Ask Sid. So we'll keep waiting for some more questions to answer and deep dive into. Until next time, remember, health is by choice, not by chance.